Portfolio. What does that mean?
Prep. Do I need that?
It sounds complicated.
Tell me about it.
I don't have the time.
Prep. How do I do it?
Does it mean me? Portfolio. Do they think I need it?
Tell me about
I don't
it.
understand.
Every 3 years.
Confused? Not surprising, but unravel the words a little, and it really is simple to understand. A portfolio is a private collection of evidence which demonstrates the continuing acquisition of skills, knowledge, attitudes, understanding, and achievement. It deals with both the past, the present, and the future, and it should cover both your professional and your personal life.
It's not only just nurses, midwives and health visitors that are going to have to prepare portfolios. Other professionals have and have done so for a long time, such as architects who take a portfolio around to show the wealth of their job.
A profile is a selection of evidence drawn from the portfolio. The evidence will be shown to another in order to fulfill a particular function. The two terms, portfolio and profiles, are frequently used and appear interchangeable. The profile required by the UKCC, which shows you have met the statutory requirements for your continuing professional development, is the one that appears to cause the most anxiety with nurses.
Continuing professional development is about maintaining and enhancing the knowledge, expertise and competence of practitioners throughout their career according to a plan.
Profiles are for all nurses regardless of which country in the British Isles they live in. If you are a nurse in Scotland, for example, you still need to provide evidence of continuing professional development every 3 years for re-registration purposes. Nurses, midwives and health visitors are required to notify the UKCC once every 3 years of their intention to continue to practice, commonly known as the re-registration.
When your re-registration comes up, the UKCC will ask you to sign that you have completed your professional updating.
The UKCC require all nurses, midwives and health visitors to undertake a minimum of 5 study days within a 3-year period. That doesn't necessarily mean 5 chunks of study days. It can actually be spread over a period of time.
It's up to you to confirm, to attest that you've actually done this, because they will be using self-verification for it. However, the UKCC will audit a percentage of practitioners to ensure that they really have done this and to monitor the sort of professional updating that people have been undertaking.
People can't conceptualise what it is, and because it's been laid down by the statutory body, it seems to be something much bigger than in fact it needs to be.
A lot of nurses think by going to a conference and receiving a certificate of attendance, that's evidence. Well, it is evidence that you have attended an event, but it isn't evidence that you've actually learnt from that experience. So again, if you can get people to reflect on what they've achieved at that day, perhaps set learning outcomes and what they might want to take back to their workplace, and then write that up in a report form or just as a series of a case study, that's the kind of evidence that they're looking for.
The important point is that whatever you've attended, a conference, a participative workshop, or a more structured seminar, all the information concerning the event's education objectives, what you hoped would be gained from it, and what you have gained from it, is documented. Some nurses attend courses which are assessed and receive certificates. Even so, what you have gained and how this can be applied to your practice needs to be written down. Private study, a literature search in a library, is a possibility. But again, it needs to be documented. What were your objectives? Why that subject? What did you learn? And how did it change your practice? Others can do an RCN nursing update unit and assessment. The workplace assessment provides you with evidence of how you've improved your practice by studying the unit. Nurses can write articles, develop learning packs, run courses for nurses, and present papers themselves. And again, the important point is to document what you did and why, and what was learnt, and importantly, how it affected your day-to-day work.
Nursing is an oral profession, And so writing often phases nurses. But I think once they start, they'll realise it's not as daunting a task as they originally thought.
All this documentation is kept in a portfolio. This is a portfolio. It's a file which contains, amongst other things, personal details, job descriptions, certificates, references, and learning objectives, and evidence of courses and study days. Everyone's is different. They're unique, and each person's portfolio will reflect the uniqueness of that individual. That's the whole point of a personal, professional portfolio. Some people will want to purchase a portfolio, but you don't need to.
I think that most of them at home will have an A4 folder, and most of them will have 5 dividers sitting around, or old dividers that they can turn around or new ones they can buy. Nurses think that the prep proposals and the portfolio development is something very special, and therefore the more you pay for a portfolio, the more magical qualities it'll have in terms of things like reflective practice. Portfolios can range from being quite large and detailed through to being even Filofax size. The way that nurses use them and what they write down will be the key. So therefore it seems to me that a nurse that's starting to think about portfolio development might be better to devise their own version of it with some guidelines.
It doesn't matter in which order the sections appear or whether they're missed out altogether. The portfolio is about you, and it's your choice and your taste. There could be a section for a curriculum vitae which states standard educational achievements gained at school, university or college. And it could include past and present job descriptions and references, as well as professional certificates of educational achievement. There could be a section for current professional nursing experience, what you're doing now, as well as a section that contains reflection on your practice. There could be a section that contained articles that you've written, relevant press cuttings and photographs. And importantly, there should be a section about you, the person, as opposed to you, the nurse. Many nurses also include an action plan. This is a written note of where you are today in your profession and where you'd like to be tomorrow. A useful starting point is a CV, which has been defined as an outline of a person's educational and professional history. This should give first name, family name, address and telephone number, the UKCC PIN number, name of present employer and current post, a list of past posts, both nursing and non-nursing. And it should give educational details, generally secondary and higher education and all other academic and professional qualifications. And you should indicate your age.
I read in quite a few books that now they're finding that is very discriminating if the first thing that they see on a CV is your age or your date of birth. So that comes at the end now. So they've read most of your good points and your key points by the time they get to how old you are. And hopefully they've been sold on what you've got to offer before they reach how old you are.
Depending on why you need to use your CV, say for a job application, it can be adapted to show your differing skills and experiences.
I had to do a plan of action so that I knew exactly where I wanted to go, so that I could then pull out of my portfolio all the relevant parts that were necessary that I felt to put forward for this particular employment. It took a lot of time. I think I did about 10 before I got it right.
Nurses need to think about any past experiences and qualifications. What skills did you learn and how have you used them in nursing? Don't only think it, write it down.
Can we just move on to sort of the past experiences that you've had? And I want you to include here the past experience that you've had in former jobs, because lots of nurses ignore that.
I was working in retail. I only came into nursing when I was 37. So I had quite a wide experience before coming into nursing. And I was a housewife and a mother.
So that comes on to your life experiences as well, which are often more than your work experiences.
What does being in retail mean? What are the skills involved there?
I used to do a lot of stock ordering. I used to do the cash. I used to do the accounts. I had to make sure that the staff were trained. I took my certificate for supervisory management while I was working in retailing.
If you had to sum up in one or two sort of phrases what that experience gave you towards nursing, what would it be?
It gave me a feeling that I could manage staff and I could work out rotas for working because I had to do that in the shop. Also budget control for ordering your dressings and also organisational skills because we did a lot of moving of fitments in the shop and I do a lot of movement of patients, so it used to put me into line for setting myself targets and achieving them.
And it's important to note your professional career.
You've really got some impressive documentation available here in terms of what you've been doing professionally. If you'd just like to take me through that just very quickly so that we can think about your current professional role and then perhaps we could expand on some other areas of your portfolio.
I first started training at Whips Cross Hospital and there I did a 3 years RGN course in general nursing. After qualifying, I spent 9 months working on a paediatric unit, caring for children ranging from the age of 5 to 14. Then went into the community and worked as a staff nurse in the East End of London. I then went on to do the district nurse diploma course at North London University.
By looking at your past and current professional career, you can see what you've learnt and how that informs your current work. Carol, for example, had undertaken work as an RCN steward.
I've learned better interpersonal skills, better communication, and I think I've got more empathy now with my patients, definitely more empathy with them. I think I've become more confident and more assertive since I've been working as a steward. I've had a lot of enjoyment from being a steward. I've learned how to negotiate, how to bargain. I've learned all sorts of things with being a steward. I've learned how to be more tolerant, I think, of people.
I think this conversation really has shown you that you've a richness of experience there, which you've got to capitalise on, there's no doubt. Do your best to put them down as if they relate to you, so they're written as achievements, factual achievements. Not just be tempted to write a year in care of the elderly or a year in orthopaedics, but to say something more about that experience and the extent of any innovation in practice that went on.
It's a matter of identifying what it is you've learnt and not being shy.
I think before I just thought, oh, I'd spent 12 months doing this, full stop. I'd spent 12 months here. It's only when you actually sort of break it down and think, well, I learnt that and I did that. And not just that, but that sort of changed me. That experience changed me as a nurse and as a person.
And what about the section concerning reflection on practice? What does that mean?
That's what many nurses are asking themselves. And they've probably been doing it for years, but they haven't been doing it wittingly. And they haven't recorded it, and they haven't thought it through. It's really how you learn from the experiences you have as a professional nurse.
Some nurses call it a reflective journal, some a reflective diary.
A reflective diary is a way of a nurse, midwife and health visitor focusing on an incident and using that incident to develop their learning from the experience. But what's important about the diary is it's written evidence, so we all know that writing actually helps us to make more sense of an experience that we've had.
Could we talk a little bit more about your reflective diary, which you've been keeping for some time now?
I started off keeping a reflective journal when I actually started the district nursing course, because they showed us that was a useful way of actually putting down what we have achieved so far and what we aim to do and as we developed through the course. I also found that if any difficulties came up or problems came up within work, I could actually jot these problems down, look at how the ways of solving it and how I did, and look back and say, well, was there a better way for me to do that? And sometimes, looking back at it, it was quite painful Some of the experiences were quite painful, and you think to yourself, oh, I should have done that, and I didn't. But I'm learning by it, and I think next time if a situation occurs, this is what I should be doing, and I will be able to handle that better.
When you do write these things down, it confirms a lot of your skills, your competencies. And I think that's good for nurses. Nursing is largely invisible. And so therefore the cues, the reflective practice, at least on paper, makes it have a visibility, a worth. And that gets translated, I think, into self-worth.
The portfolio will need to include details of your UKCC PrEP registration.
I think it's important that everybody realises that PrEP is not just about clinical skills. It's not just for clinical nurses. It's for nurses irrespective of what their job is.
We have to remember that the UKCC's PrEP requirements for practitioners to undertake 5 days of professional updating is a minimum requirement. If practitioners were only to do that, suppose they were just to attend 5 conferences and just come away with 5 certificates of attendance, there would be nothing there to prove that they had maintained and enhanced their knowledge, expertise and competence in the interests of their patients and clients.
The Council has suggested 5 categories that relate to what they consider to be relevant areas of study for professional updating. Reducing risks. For example, if you're a practice nurse, you might want to undertake a path of study which relates to how you could set up a smoking cessation clinic. Care enhancement. Here, you might include time spent at a workshop studying new wound care techniques. Patient, family, client and colleague support. Spending time devising a plan for improving your care of clients from minority ethnic groups based on available strategies would fit into this category. Practice development. Studying a unit of learning from the RCN Nursing Update project on aromatherapy. Education development. In this area of study, you might visit a nurse aromatherapist to assess how effective use of the therapy could work in a specific nursing setting, and follow up the visit with guided study. From these suggestions, you can see that you can fulfill the requirements for professional development in a variety of ways. But what about the section that's about you?
I think nurses all too readily don't value the kind of day-to-day family and social networks that they belong. So that does need to be in. That's the whole person as far as I'm concerned. And you learn from that experience as much as you learn from your professional experience.
I also know from your personal details in your portfolio that your personal life is also incredibly busy and fulfilling.
I think for a mother it's quite difficult to have a correct balance between work and home. And I think it takes a lot of organisation at home, organising your life with work in mind. And that's helped me to bring that across into work and to organise myself at work and to organise a team. I'm quite involved with the twins at school and their school committees and fundraising events that take place at school. One of the other things that's a major part of my life is that I am a Christian and I do go to church, and here also I meet people and get on with people. It's also helped me in caring for patients who are actually dying and for bereaved relatives, because I find that I have a sort of a strength from my Christian faith I can draw on to help others in like bereavement visits and bereavement counselling.
A portfolio needs to show a rounded picture of you and how or what you do privately feeds into your professional life.
Are there aspects of your life outside of nursing that you think have contributed towards nursing?
I've always been politically aware. My father has been a local councillor, still is. We used to push leaflets through doors and things like that at election time as a child. And I think that made me aware of the politics of nursing and the politics of health when I came into nursing. And that brought me almost directly into being active within the Royal College of Nursing from within weeks of becoming a student nurse.
How would you sell yourself What qualities do you think you have?
I suppose when I look back on my career, there are certain things that I can highlight and say that's of value. I was a steward of the RCN for a very long time. I was an elected member of the council until I took my present job for about 10 years, and have participated in various activities over the years in order to fight the cause of nurses and nursing. I also have, through my career, developed management competence and have managed colleges of nursing. I think I'm a good decision maker. I think I'm able to show evidence that I've been creative, that I've enabled change in institutions and enabled people to change. All of which I think I could pull together and use as evidence in applying for other types of work.
Did you find becoming a father affected you in nursing particularly?
I like to believe I was always caring, but it brought in greater wisdom, influencing decision making in that way. It also, I think, gave me experience in the emotional front that I wouldn't otherwise have faced, that has enabled me to relate more ably when I was a clinical nurse to patients, and even in my present role to people at large, and to have an empathy for what nursing's really about.
What is a cat's favourite TV programme?
Don't know, what is it?
The Muse at 10.
Yeah,
What is it you like about football, Tom?
Well, I just find it exhilarating. It's a great escape from stresses at work or home, even if you like. I think it's something that gives you common understanding. Even across the generations, it's something that you can use as part of conversation with people. The way any team plays is about making sure everybody understands and communicates and so on, and I think that's important in any management role. I think teamwork itself is important in any management job, and you can't do it without having the team with you. I also go ice skating with Sarah, and we generally have a good time falling over and wobbling. I like to go out for a meal and I like to have a drink and so on. That often overlaps with work anyway, because particularly my sort of work, there's quite a lot of having to meet people, networking and so on, and it's nice to be able to do that in relaxed environments. I can be a sociable person at the end of it there, and so without it I don't think I would be, as you describe it, Tom the man. I don't suppose I'd be Tom the nurse either. I think what you do in your leisure must influence how you work and vice versa.
And the action plan, where does that fit in?
What I've done, in a sense, has given me an idea of the gaps and what I need to sort of do now to progress to that and start to search out the things that I need to do.
Is that going to be your career route, or is this just a temporary sort of diversion?
I think this is what I'd like to do ultimately. My feeling is, looking at advertisements for Marie Curie nurses, is that community experience is seen as very valuable, almost as necessary before one can take on a post. Would that be a very big thing standing in my way, not already having some district nursing experience?
I think Marie Curie in particular is looking at those people who are committed to working in palliative care, and if you've obviously shown an interest, that's often as important as a piece of paper which says you've had a community experience.
And an action plan helped Carol pursue her goal to be a full-time officer at the RCN.
I hope I can help you in the directions that you ought to be going in. You've taken major steps because you're currently a steward.
I've been a steward for 6 years and a convener steward for 2 years. I've done a lot of Royal College of Nursing courses in negotiating, pay bargaining.
Can we just examine for a minute what you've actually learned in terms of application of that? What's the sort of situations that you've dealt with as a steward?
I think one of the ones we first had when I became a convener was the closure of one of our hospital sites. And we had to redeploy staff. Some staff unfortunately lost their positions, but that was through voluntary redundancy. In the end, we only had 4 people that had to take redundancy.
That's quite an achievement. I presume that you dealt with a lot of senior managers from the hospital on an equal basis as an RCN representative.
Yes,
Did you find that helpful?
I did find it very helpful, and I found how to become more assertive and how to talk to management and deal with them.
It's that kind of practical experience which is probably of most value to the sort of things that you're trying to look to.
A portfolio will give you an overview of your past and your present and will help you look at your future.
Just start really at the beginning. Collect the things about you that you think are important. Perhaps start reflecting on what you're doing now.
Don't be terrified. I think it's nice now that I've put everything together that I've done and I can see what I've done. And I found it nice to be able to put everything that belongs to me in one place. And I look at it, I think now, with awe and think, why was I frightened? You know, haven't I been good? Haven't I done well?